what I'm going to do is I'm going to share with you some of the findings from a Delphi survey that we conducted to elicit expert opinion on what are the main research questions that the future generation of birth cohort studies should be focusing on. So EBLS is, of course, a birth cohort study for many reasons, but one of the reasons is that birth cohort studies have got a really strong history of generating really high quality evidence on child development and of also stimulating policy change in this domain as well. But as our knowledge in the area of child development advances, we need to kind of be making sure that our birth cohort studies are keeping pace with that advance in knowledge, so that we're kind of continually asking ourselves what are the research questions that are the most pressing current research questions that birth cohort studies should be focusing on. And when we're thinking about the future generation of birth cohort studies, it's really important for us to bear in mind that the majority of the world's children actually live in low and middle income countries. And it's in these contexts that they're more likely to be exposed to the kind of factors that undermine their ability to reach their full developmental potential. And at the same time, in terms of birth cohort studies, low and middle income countries remain significantly underrepresented. So as we're going forward and designing new birth cohort studies, establishing new birth cohort studies, we need to be not only doing it in low and middle income countries, but also making sure that researchers from low and middle income countries are part of the conversation when we're setting the research agenda for what those birth cohort studies should be focusing on. So with that in mind, we conducted a Delphi survey of academic experts where we systematically gathered and analysed the views of experts on the question of what future birth cohort studies like EBLS should be designed to address in terms of research questions. And so the Delphi method is basically a way of systematically gathering stakeholder views, particularly in the case where you've got potentially diverse opinion holders. And it kind of has this inbuilt mechanism to try and nudge stakeholders towards some sort of consensus in the case of sort of disagreement or diversity of opinions. So what we did was we proceeded in 3 different stages. In the first stage, we asked academic experts to tell us what do you think are the top 3 burning research questions that you think the next generation of birth cohort studies should be focusing on. And then we had the expert panel rate each other's research questions and their own research questions in the context of everybody else's. And for those questions where there was not very good agreement on how much of a priority they were, we had the experts re-rate those questions, reminding them what they previously said and telling them what the average sort of group response was. And that's the part that tries to nudge people towards consensus. So with that data, we basically looked to see what are the top rated research questions that experts believe birth cohort studies should be focusing on in the future. Our panel was identified by the EBLS Consortium, and we basically asked people to be involved who are experts in fields where birth cohort studies are a primary methodology. And we were particularly interested, given this underrepresentation of low and middle income countries in birth cohort studies, of getting the views of experts who are working in or have experience of working in low and middle income countries. When we talked to the experts, we didn't advertise the link to EBLS because we didn't want to risk biasing their responses, so we didn't want to kind of prime them in any way so that they just kind of responded with questions that they thought were in line with what we were trying to do anyway, so we really wanted to know genuinely what they thought. We had 24 experts, academic experts participating, most of whom had experience working in low and middle income countries, roughly equal gender split, and we had quite a range of different disciplinary backgrounds represented. So we had like child protection, psychiatry, who did we have? We had public health, psychology, the range of disciplines that you would expect to be involved in researching child development using birth cohort studies. So when we asked the experts to generate research questions for us, after we got rid of the ones that were essentially duplicates of one another, we had 47 unique research questions, which fell into 6 broad themes. The first theme was the influence of the psychosocial environment on child development. So we had, for example, a question that was, how do inequalities in human, social and economic capital play out in the early years of children's lives? Another strong theme was informing interventions. So we had, for example, one suggested research question which was, what would be the effect of interventions to increase fathers' involvement in children's lives? We had a strong biological factors theme, which referred to the kind of biological influences on child development and the sort of biological embedding of exposure to different risk factors. And an example of the question there was, what is the mediating role and reversibility of epigenetic effects on developmental processes and outcomes? Another strong theme was developmental trajectories. So we had one question that was, what factors can help children with mental/physical delays to catch up with normally developed children, which is quite relevant for low and middle income countries where prematurity, stunting, other factors related to mental and physical delay are higher than in high income countries. We had a theme around parenting and parental factors, such as this question, what drives parental behaviour, what effect does it have on child development? And then lastly we had a few questions in the theme of nutrition and health, such as the question, what factors contribute to healthy choices/behaviours over the time course? In terms of the top 5 questions though, our experts ranked these questions as the most pressing for the future generation of birth cohort studies. So the first one, how do environmental and family context shape children's developmental outcomes over time? Very broad question, very important question. Second question, how does disadvantage get transmitted from one generation to the next and how can this be changed? In third place we had, what are the leverageable risk and protective factors that can be the target of interventions? In fourth place we had another question that was on the topic of informing interventions, which is what sequence of interventions at which developmental ages can support children's developmental outcomes. And then in fifth place we had, what are the most effective ways to ensure equal opportunities in early life? And although they didn't make it into the top 5, the questions relating to biological influences on child development also tended to score quite high. I think they probably accounted for most of the rest of the top 10, but probably why they're not in the top 5 is that they were a bit more specific in their scope. So in terms of what this all means for the next generation of birth cohort studies, if you just look at the top 5 questions, one lesson that we could draw from this is actually that in many ways the most pressing research questions for birth cohort studies remain the same ones that have been the subject of research in birth cohort studies for many years and decades already. And perhaps what we need is not to define totally brand new research questions, but to think about new methods and approaches to better advance knowledge in those more traditional areas. I think that social inequality is quite a good example of this. So this was a really major theme to come out of the Delphi survey. And perhaps why we haven't made so much headway in the question of social inequality in the context of child development is that if you want to understand these macro level variables that vary at the level of the society and how they kind of interplay and filter down through sort of community, neighbourhood, individual level factors as well, family factors, you really need multiple countries that are comparable in terms of their data so you can actually look at the sort of full political, cultural, social variation at the macro level, as well as have really strong individual level data that's comparable across the sites. So I think that's one big advantage of EBLS, that it's got this 8-site design where everything's happening in parallel, it's comparable, and we also have this massive diversity in terms of social, political and cultural contexts. We are of course looking at other methodological innovations that we may want to include in EBLS as well, so we've commissioned or are kind of working on a series of technical reports that are looking at methodological innovations. We've been looking at the use of event history calendar methodology during pregnancy to better get at the timing of events during pregnancy, because we know that the timing of exposures in pregnancy is important for outcomes, but the details of that picture are really kind of missing at the moment. We have a technical report led by, it was Laura who led it, wasn't it? On neuroimaging methods within the field as well, to make it feasible, neuroimaging methods that we could use to help understand brain development in the context of child development. We've been looking at feasible and informative biomarkers, and you've already heard a fair amount today already about the involvement of fathers, and that would be genuinely a really strong innovation for EBLS if we manage to pull that off, given that fathers have been quite neglected in previous birth cohort studies despite the importance of their role in child development. Another lesson to come from the Delphi study was, in my view, the necessity of integrating biomarkers within the next generation of birth cohort studies. There were quite a few questions directly referring to biological processes and quite a few other questions that you would argue couldn't really be comprehensively answered unless you had some sort of reference to biological processes. So what we're planning to do in EBLS is to establish some sort of biobank so that we can collect biosamples that can be used to obtain a range of different biomarkers that are relevant for child development, and that will act as a general resource that can be linked to the other data that we'll collect. You heard already about the work that we've done piloting the collection of biosamples. We collected hair samples and dried blood spots, and that, I would say that went very well, so I think that we'll almost certainly take that forward into the next phase of EBLS. Another important lesson is the importance of informing interventions for the next generation of birth cohort studies. And I think there are a few ways that you can do this. One of them is to embed intervention evaluations within birth cohort studies, but there are also big disadvantages to that in some ways. It's adding a lot of costs and logistical challenges. How do you find an intervention that can be used across 8 different sites that's comparable, relevant for all the sites, when you have such different needs? And then there's the kind of more sort of conceptual scientific issue of, if you're embedding interventions in an observational data set, is that actually undermining the use of the data as an observational data set? So there are issues, and I think there are compromise positions, and I think one thing that works really well is really making sure that you're involving the right stakeholders from the very beginning of the research, keeping them involved through the whole life cycle of the research to make sure that those stakeholders who are relevant for informing interventions are helping you to design a study that's going to be informative for interventions, and when those findings are available, that they're actually translated into interventions as well. Okay, so the last lesson I think to be drawn from the Delphi survey is kind of an obvious one, but it's the importance of having a multidisciplinary focus and a multidisciplinary team that's backing up that focus as well. We sampled people from a range of different disciplinary backgrounds because there's so many different disciplines involved in child development. It is kind of an inherently multidisciplinary issue, how to support positive child development. And we got a kind of correspondingly diverse set of research questions. And if we really want to be a general resource that can be of wide benefit to lots of different fields and really kind of understand child development, we need to have that multidisciplinary focus and the team to back it up. And I think we do that quite well in EBLS. We've got psychology, public health, pediatrics, criminology. We've got a wide range of disciplines feeding into the design of the project. I think that's really good. The last point is not really something to come so much from the Delphi survey, but just something I want to repeat because I think it's really important. And that's the importance of addressing the underrepresentation of low and middle income countries in birth cohort studies. We just have so much still to learn about how children are developing in non-Western contexts and non-high income contexts. And I think one thing that's really nice about EBLS is that it's specifically focusing on low and middle income countries, and it's focusing on a set of really diverse low and middle income countries as well, so we can learn about children across lots of different cultural, political, geographical contexts. So what I'll do is I'll just leave up the all of the 47 research questions that were generated. You can scroll down if you want to see them.